Good morning. I am Dr. Fatou Francesca Mbow, and I am a general practitioner in the southwest of England, in Plymouth. And I would like to talk to you today about what I have called attentive medicine, which is really a part of conventional medicine that I focus on, develop, and give emphasis to, because I think it is extraordinarily important in a holistic way to look at our diseases, at our healing, and at what it means to change. I will start first with what took me there, the questions that I asked myself, the kind of definitions of health and disease that I felt comfortable with, and then what I tried to craft throughout my professional life as attentive medicine. I studied at the Catholic University of Rome because my mother is Italian, and then I came to London because my ex-husband was in the UK and really worked in obstetrics and gynecology, in emergency departments, in sexually transmitted infections, and then in general practice as a whole, and became a GP. I then decided I wanted to deepen my understanding of health through humanitarian health work, and I worked in sub-Saharan Africa for 13 years. I was based in Senegal and in Kenya, depending on jobs, and I would visit refugee and internally displaced camps and emergency settings throughout sub-Saharan Africa for 13 years. I then came back to the UK when one of my sons, wanted to come back to Europe, and I then went back to general practice. I had in the meantime worked a little bit in research, in clinical research, as well as in the pharmaceutical industry. All of this experience made me ask 4 big questions. The first one was, if we are nature, if human beings are nature, how can we tell nature that it makes a mistake through disease? How can we say that we are superior to nature in its understanding and in its intelligence? That was my first problem. My second question was with regards to anxiety in medicine. Very often patients were very anxious about their diseases, and I didn't feel we were very different from them. In accident and emergency, I could see the anxiety that was expressed very often, and I felt there was something about anxiety that wasn't healthy, that needed questioning in health. The third question I asked myself was, seeing that I became as sick as my patients did, that doctors are around me, including in my family, because I'm a 3rd generation of doctors, were as sick as anyone else. And the doctors that I met in my medical schools as professors, etc., they were all as sick as anyone else. And so I thought, what is this medicine that is so extraordinary at removing symptoms, but leaves its doctors as sick as anyone else? And then finally, the other question that I asked myself was about side effects and about complications. I mean, we call these side effects. I didn't find that there were so side effects. There were effects of medications that needed to be taken into account as much as the wanted effect. And complications of surgeries were not like little. I did see quite dramatic ones, and I felt that we were not enough interested in these side effects and complications. I was also interested in what does it mean to be ill and what does it mean to be healthy, and I wasn't very I didn't find the definitions that I was given by the World Health Organizations or by my textbooks as clear as some of the definitions I came across throughout my journey in life and in medicine. One of them was about health being the silence of the organs, and the other was about illness being a lack of vital energy and vitality. I thought it was very true that both in mental health or in physical health or in both, we really had a diminished vital energy, a vitality that had diminished. So all of this led me to the crafting of what I call attentive medicine, which is really trying to answer the question, why did the body change at this particular time, in this particular way, in this particular individual? I offer 90 minutes consultations, during which there is a very attentive listening to the patient, but also observation of what they say and the way they say it. And then really a questioning and a deepening of the various themes that the patient brings into the consultation on the question, around the time that your body changed, what was going on in your life? And what we actually usually come up, discussing, are the vital relationships that have maybe become less central in the person's life or a bit neglected in the person's life. And those vital relationships we look at very deeply. What do we often witness? Sometimes we witness symptoms that fade away. Sometimes we witness symptoms that are seen differently and therefore given a different weight. Sometimes we see drastic changes in the life of the individual. What we consistently see is an appeasement in the relationship to disease, away from anxiety, with conventional medicine doing its bit in the removal of the symptoms if needed, but with the patient holistically understanding the change of his or her body in a much more compassionate way. Thank you.